Good morning. We're here in Mexico City, very close to World Diabetes Day. And with this in mind, we're doing some interviews with key people in the sector, with diabetes experts and opinion leaders. In this case, we're with Enrique González, who's the medical director of the clinic specializing in diabetes management here in Mexico City. It's a pleasure to talk to you. We really wanted to do it for a long time.
Thank you very much. Good morning. At your orders, it's always a pleasure to participate with you.
Thank you. Tell us about what you do in the clinic and what is the approach you're taking. I know that this is an innovative approach, especially in the public sector, this 360-degree vision that you give the hospital management.
Well, right now, I have the fortune and the honor of being the medical director of the clinic specialized in the management of diabetes in Mexico City, attached to the public health service, and it was around 6.5 years ago that it was created as the only clinic in the country that at a public level, at a first level of care, attends the patients who comes with diabetes for free, but above all, in a comprehensive way. We have more than 2 specialties, from the general practitioner, the fundamentalist doctor, the diabetologist, the internist, the diabetes educator, who is a fundamental role, the nutritionist, the dentist, a chef, a kitchen, and that all this and is only focused on the structured education of the patient, in which your objective is the knowledge of his disease is empowered so that throughout his life he can make the best decisions, regardless of the environment in which he develops. We have patients from all types of economic sectors, from all types of school sectors. We also have patients who come with type 1 diabetes, and since being in a structured environment and whose objective is to educate and empower, it makes it much easier for them to live with the disease, but above all, to avoid the secondary complications of this disease. That is why the project in a public environment is innovative and a challenge where urban areas and cities inhabit the largest number of patients with diabetes. Today I want to tell you that in the city we have a prevalence of about 14%. We are approximately 12 million inhabitants in the city. Merely 8.9 of those who live here, but of those who see, work, and circulate, there are 12 millions, and the prevalence is quite high. So it is a great challenge to be with these patients for 6 to 8 months to teach them to live with the disease and that they can make wise decisions for it.
Of course, we always say that in the end it depends a lot on the patient. It depends so much on lifestyle habits that we help them live in a way that is aligned with their pathological condition, or we're going to solve the problems with a lot of treatment and a lot of...
Of course, structured education becomes fundamental in self-care. But self-care exists as long as you have the necessary information given by the educator. Because it is not worth being the best internist or the best diabetologist or the best general practitioner when you have not landed and understood that if you do not become an educator of the disease or an educator in diabetes, all the knowledge that you can harbor, you will not be able to transmit it in a correct manner to a patient. Hence the need for this education and structured in both directions. Educate the patient and educate health personnel, and this is what this clinic focuses on.
Congratulations. Also, tell us about what role technology plays in all this, because we have been noticing an evolution.
Technology, for more than 10 years, has given us a key orientation in the use and in the individualized treatment of the patient. Today, we know that there is no prescription or magic formula for treating the disease, whether it's type 1 diabetes, type 2 diabetes, when we cannot offer the patient an easier way to live with the disease. Today, speaking from the innovation technology in insulin, it has been for more than 100 years since it was the first technological discovery of the disease. Until today, continuous glucose monitoring on accessible digital platforms makes the patient feel more accompanied, that they feel more secure. But we return to the same thing so that the patient can access this type of information. Technologies in terms of care, it has to be guided by an educator. We currently have a lot of associated technologies in terms of treatment and information from, from long-acting insulin technologies, continuous glucose monitors, infusion pumps, platforms such as social diabetes, which has a great advantage in the fact that the patient feels accompanied at all times. I think the use of technology in this pandemic has been the most positive way to advance medicine. The pandemic did not tell us anything good other than this part of making the use of these platforms and technologies more muscular, because the patient does not always have the availability to access to the doctor's office or go to the hospital, and the fact that having the telemedicine or the simple fact of solving your doubts by self-management. And in terms of data compilation, it makes this much easier, and it commits us in the future to truly individualize the patient's treatment associated with self-care. New drugs and technologies, when we have this in a team along the patient, I think it holds a brighter future for the patient himself.
It is a database disease. If we handle the data, and since the data is digital, we are connected.
The patient will not be the same yesterday and neither tomorrow. That's why the use of technologies have to be, I believe, inside the formula, as important as drugs, as important as information.
It's personalized and dynamic.
Of course, the patient will not be the same. If you see him for the next 30 years and he is a loyal patient, and you are an efficient doctor, it will not be the same. We have the example of women. Women do not behave the same way when they exercise, when they have their periods, when they get sick, exactly with children, exactly with men. When they become older adults, they do not respond the same. And when you teach a patient to be much more effective, the use of technology is also more comfortable for you as a doctor, because many times the doubts are solved by themselves. They come to the office and tell you, "Doctor, look, this is my score of everything that happened to me in the last month." But what's real worth out of it is that you see it, that you analyze it with him so that you guys can make the decision together. That's a big plus.
To finish, how do you see the future? This pandemic has shaken us socially, clinically, and from now on, a window has also opened to use this type of technology that was already coming and that we already had for so many years.
I will tell you about the future in the public sector. I believe that the public sector has to bet on the use of technologies and telemedicine, especially in reducing expenses and costs in terms of health personnel and the occupation that worries us so much. The fact of crowding the first and second level properties, if we do not look at the fact that today we are in the era of forced technology, because it's already been here for more than 30 years, but nothing forced us before, and that a pandemic is showing us that there are many advantages to using them, the public sector will have to migrate. It will have to migrate, especially in what matters to them or what matters to us. Having patients controlled and costing them less money. That is the bottom line.
Very well.
I'm at your orders.
Thank you for the conversation.
Thank you for considering Mexico. Take care of yourself.
We'll see you soon.